We are on. Dr. Zeynep, welcome and thank you very much for being here on the show. I very do much appreciate your time and I feel very grateful for you. Thank you.
Thank you for having me.
You're most welcome. Doctor, for those who don't know you, can you please tell us who is Dr. Zeynep?
Yeah, sure. My name is Zeynep Zehra Gümüş. So I know my name is a little hard to say, so you can call me Dr. Zizi.
Dr. Zizi.
Yeah. I'm an internal medicine specialist. Currently, I'm working in a thyroid clinic in the Spring Souk. And I'm from Turkey. I'm Turkish. Before coming to Dubai, I have been in Dubai for 1 year now. But before coming to Dubai, I was working in a university hospital. It was one of the biggest hospitals in my city.
Doctor, let me ask you a question. Why did you choose this field in particular?
Yes, so actually, it's a long story. In my life, I never questioned about what will I be in when I grow up. I always wanted to be a doctor. And when I really started to medical school, of course, there are many options. But I know that I want to see a patient as a whole, not just an organ. That's why actually I chose internal medicine because you can see a patient with all his or her physical body, all emotions, social environment, everything can affect internal medicine field. That's why I chose internal medicine.
Very fascinating. Doctor, in your field, like in your specialty, what are, let's say, the most common mistakes that you see humans do that affect their health negatively as a doctor?
So, just one thing.
Well, I have a list. Let me tell you, where can I start?
To be honest, for general health, overall, I think stress. Because if we say stress, we have to talk about emotional stress, but also physical stress. Even an infection is a stress, physical stress, or sun exposure and processed foods. And when it comes to emotional stress, especially we are in Dubai, everyone is working, and we have a very stressful life. So probably stress.
Stress. So let's talk a little bit more about stress. What causes stress? You mentioned food, and you mentioned that the environment that we are in also affects it. How?
How actually is about biochemistry. Are you sure that you want to talk about this? Because during stress, we have stress hormones and then cortisol, adrenaline, noradrenaline, and others, and other chemicals. So they all contribute to stress. It's a very big topic. And we can go even oxidative stress and antioxidants. So, and hormonal balance, you name it. You can choose one topic, then I can continue.
Let's talk, for example, about the hormones. First, let's say let's say basically is the main, let's say, engine that produces our hormones. This identified. Is it the endocrine system in our body?
Can you please come again? I couldn't understand the question.
Yeah. So basically, we're going to be talking about the hormones and how the unregulation of hormones affects stress. But I think that first we have to identify the system in our body that controls the hormones.
Yes. So the control is usually from the pituitary gland in the brain. So the pituitary gland is like the maestro of an orchestra. It regulates all the rhythm. And in our body, we have a rhythm, we call it circadian rhythm. It means that our body can understand whether it's day or not night. And according to this, it regulates our hormonal balance for all day long. And there are some reasons which can disturb this breathing. And then we have some hormonal imbalance. And caffeine is one of them, by the way. Yes, if we drink too much caffeine, then energy drinks or normal coffee, then of course it will disturb our hormonal balance. And for pituitary gland, sleep pattern is really important. If you don't sleep well, if you don't go to bed in a certain time, and if you don't wake up in a certain time, definitely this routine will be disturbed. So you need to sleep between 6 and 9 hours, according to the studies. And also, sleep hygiene is quite important, but it's also another topic. And of course, there are some hormonal disorders that can affect our sleep pattern.
Wonderful. Doctor, I have a question about sleeping. You mentioned that the regularity of sleeping plays a role. So does that mean even if we sleep, let's say 6 to 9 hours every night, if we were not regular, we would be, let's say, in a worse scenario?
Yes, correct. It's better to go to the bed at the same time. Even at the weekends, we should be careful about that. But in a week, of course, one night or 2 nights, we can skip the pattern. But overall, we need a pattern actually.
I see. Now let's talk about caffeine. Why is caffeine bad for, let's say, our sleep cycle or our habit of sleeping? How does it disrupt our sleep? Because a lot of people drink caffeine, and I think that we as humans are addicted to caffeine, and it's a big part of our life. So I think it's something that we should, let's say, notify people of the importance of it and how does it affect us.
Yeah, it causes addiction definitely, but how it disturbs the sleep pattern. So when you drink caffeine, and then cortisol and adrenal hormones will increase. They are also known as stress hormones. Especially adrenaline is about fight or flight response. And for example, you are drinking the coffee in the morning. So in the morning, usually we have many hormones because our body tries to wake up us. That's why we need many hormones to wake up. But if you drink coffee, then automatically the adrenaline will go high. And then the body will be awake. Then it will say that, okay. And if you do it every day, then the body will say, okay, he or she already drinks coffee and there's caffeine. So I don't need to release all these hormones. So the body will be lazy. It will stop to release these hormones, or it will release these hormones. And then, if you drink coffee every day, then you will get adapted to coffee. It won't affect you that much. That's why you will need more and more coffee during the day, or energy drinks, because they also include caffeine.
I see.
So so for a healthy life, it's better to avoid coffee early in the morning. It's better to drink it after 1 p.m. or 2 p.m., but definitely you shouldn't drink it before 10 a.m.
Very fascinating. Doctor, I heard once that caffeine has makes people more anxious. Is that true?
Yes, true. 100% true, because it will cause to increase adrenaline and noradrenaline. So with adrenaline, you will have higher heart rate, increased blood pressure, and that's why you shouldn't measure your blood pressure in 30 minutes after drinking coffee. And also, noradrenaline will cause alertness. So you will feel always like alert. It's like always there's danger around you. That's why it will cause irritability, nervous, anxiety.
So caffeine plays a role in anxiety, and I think then maybe it could be one of the reasons why, because of the disruption of the hormones and the sleep cycle, we can say that it plays a role in depression. Can I say that?
Depression. So when it comes to depression in the long term, yeah, it can happen because depression is very related to cortisol and even cortisol receptors. Actually, if you drink coffee all the time, it can cause higher cortisol levels, and this is how it can cause depression. And when it comes to depression, I want to also talk about these receptors. So, cholesterol receptor means that it's a molecule that understands, oh, this is a cortisol molecule, and then it binds to that cortisol and brings it into the cell. And inside the cell, then stress response happens. And there are studies that if you have a high cortisol receptor, then it means that you are prone to depression. And it is genetic also.
I see.
Yes, that's why it's better to have cortisol levels as low as possible. That's why we need mindfulness, meditation, no caffeine if possible. If you will drink, maybe you can drink espresso or Turkish coffee in small amounts and once a day only.
Once a day, not like more than water. Some people drink it more than water.
This is also wrong, yes. Because we need water itself, not coffee.
Doctor, can you please introduce us to the thyroid gland and what role does it play in our human body? What does it do basically?
Yeah, actually, it's like the petrol in the car. This is what it means for our body, and it has this lovely shape. It's a butterfly shaped gland in front of the neck, and the thyroid hormones are T3 and T4. We have only two thyroid hormones, T3 and T4. The active form is T3. T4 is like a depot. T4 is converted to T3. And there is TSH, and it is also coming from the pituitary gland. It gives an order to the thyroid gland, work, release thyroid hormone. Anyways, when TSH comes, then we have T3 and T4 release. They go into every cell, every tissue and organ in our body, including our brain. Without them, we cannot produce energy. So to produce energy, of course, we need other molecules too. But definitely, we need thyroid hormones. Without thyroid hormones, you will feel fatigue. Because imagine, in the brain, there is no energy for the brain cells because the brain requires lots of energy. During the day, we have a metabolic rate, basal metabolic rate. Even if we don't do anything, we consume energy. We burn fat and carbs. And not most of them, but many of them are from our brain actually. And thyroid hormone doesn't only give energy to the brain cells. It also helps to regulate some neurotransmitters like dopamine, serotonin, noradrenaline, and they are all related to our mood.
Fascinating. Doctor, on a normal person, what can disrupt, let's say, the production of, or let's say, the regulation of hormones? What disrupts our, let's say, production of hormones, let's say?
Let's say which hormone?
The production of the thyroid hormones. You mentioned that, like, it's very important to, what's it called? Like, stabilize our metabolism and to produce energy. So I'm assuming that if there's a hormone or there's something that we do on a daily life that disrupts the production of these hormones, it will affect us negatively. So what are the causes that disrupt the hormones?
In a normal gland, it will definitely work. But to be able to work, it needs iodine. In some, yeah, in the world, there are some places they are lack of iodine in their foods, daily food. That's why they are tend to haven't got. But now we have iodine in our salt. So during eating any food, we can take iodine. So we don't see as much as before. Previously, it was a bigger problem. Now we don't see it. Now we have diseases to disrupt thyroid hormones, and hypoactive thyroid, hypothyroidism, is quite common, and the most common reason is autoimmune disease, Hashimoto thyroiditis.
What is it called?
Because there are Hashimoto thyroiditis. Yes, it's an autoimmune disease of the thyroid gland, and there are some autoantibodies in our blood circulation. They go, normally, our body immune cells recognize our body cells. They are like, okay, this is a friend of us. But in this disease, these antibodies assume like thyroid cells are an enemy. That's why they attack thyroid cells. And in time, not all of a sudden, but in time, these cells are decreasing, and in the end, there is not enough cell to release enough thyroid hormone. And then at that point, we can see hypoactive thyroid, hypothyroidism.
So hypothyroidism can happen via the, let's say, disruption of, okay, I see that. Now, doctor, once I was reading that in case of hypothyroidism and hyperthyroidism, doctors usually prescribe thyroxine. So my question is, first, is that true?
Yes, true, because if there is no thyroid hormone, we can give this thyroid hormone oral. There are pills, and in every morning, the patients should take these pills, and we don't see side effects that much. I haven't seen any side effects of thyroxine, by the way, because it's the natural hormone already. It's the same giving insulin to a type 1 diabetes patient.
I see. My question is, why is it in both cases, the hypo and the hyper, that we prescribe thyroxine? I mean,
No. I'm sorry for interrupting, but for hyperthyroidism, we have anti-thyroid hormones.
thank you for correcting that, because like I actually had like a misconception.
Sorry?
I had a misconception before, so thank you for correcting that.
Yes, and for hyperactive thyroid, sometimes surgery can be needed. Yes.
Doctor, is there any other gland that can affect our mood besides, let's say, the thyroid and the adrenal gland?
I'm sorry for interrupting, but the voice quality really reduced. I couldn't understand.
Is there any other gland that affects our mood, basically, other than the adrenal gland?
Other than thyroid gland and adrenal gland?
No, I mean, is there any other gland that can affect our mood? As I know, the pituitary gland is in our brain, and it's in the much of the hormonal system. So is there any other, let's say, gland that affects it as well?
Yes, actually, our ovaries. So we have not affected hormone, like not affected glands. For example, pancreas is a gland, but it doesn't affect. Thymus is a gland, it doesn't affect. But pineal gland can affect because it releases melatonin hormone and it regulates our sleep. And if there's some disorders of pineal gland, then the melatonin levels will change and it will cause sleep disorders and the hormonal balance will completely change. And also our gender hormones are quite important for our mood, testosterone and estrogen.
Ah, interesting. How so?
So for example, testosterone. Testosterone affects brain areas, but which brain areas? Of course, sexual function area, and also cognitive area and mood area, mood functions area. That's why testosterone is quite important to feel the self-confidence, self-esteem. And it's quite important to feel the motivation. You know, you have that fire inside you, and then men always chase. They are always trying to achieve more and more. So it gives the motivation, sure, and it gives the energy. Without testosterone, a man will feel fatigue, less energy. Of course, less decreased libido. Sexual functions will be impaired. But also, there will be some behavioral changes. For example, if the testosterone is normal, then the person, the man, want to be dominant in any kind of relationship. So it will affect all of his life. But if there is not enough testosterone, then he will be more passive. Definitely, behaviors and mood change because testosterone deficiency causes depression and also anxiety.
Fascinating, actually. Like, it's very fascinating how a hormone like the testosterone can make the person, let's say, more willing to take risks or more willing to take initiative, stronger mentally, physically, and the lack of it affects us like in a completely different manner. So in a way, it's like we are hormones that is moving inside the body because it affects it heavily. It affects our decision making. It affects how we behave in a society.
Definitely, and it will affect all your relationships. By the way, unfortunately, I have to say this. So, if we look at the previous time testosterone levels, it was higher. Now it's like all men have low testosterone levels. Because previously it was between 800 and 1200, but now if it's 300 and above, then we say, okay, it's enough. And there are some men who have these high testosterone levels, 800 and 1200, but we find them mostly in jails. So jail, they are usually in the prisons. So it's good to have current modern world's normal testosterone levels because it will protect you to go into jail. But maybe sorry.
I'm saying like unless you like going to jail, then well, it's okay.
Yes, it's okay.
Right? Doctor, does it mean that people who have higher testosterone tend to be more violent or tend to be, let's say, more opposing to authority, and this is why they go to jail?
So they tend to, yes, violence, and also they tend to be more aggressive because of that aggression. Yes, they are in jail.
Doctor, what do you think is causing the decrease in testosterone levels in nowadays men? Like, why do you think it's decreasing bit by bit?
So there are some social and physical reasons actually, and about these physical reasons, really, endocrine disruptors are one of the main reasons because we all have processed food in everywhere, but in this processed food there are many chemicals that affects our hormonal balance. And also chicken is another problem because many chicken, they are not organic and they have lots of antibiotics and hormones. Chicken is basically estrogen. And many people eat chicken, especially while going to the gym. But it's better to eat red meat actually. And we don't need excessive protein, by the way. And 1 gram protein for each kilogram is enough. So if you're a 70 kilogram man, you need 70 gram of proteins. And there are studies, if you are taking more than 1.4 gram protein for per kilogram, it has no meaning. You won't see any difference. So yes, 70 multiply 1.4 is around probably, let's say, 90 grams. So you don't need more than 90 grams of protein actually. That's so simple. Yes, we don't need that much protein. Even if you're a bodybuilder, of course, if you are trying to go like Olympics or if you're trying to achieve a record, so if you're a professional, maybe the diet can be different. But I'm talking about general population. Anyway, so it's better to eat 3 times red meat per week, once a week chicken per week, and once a week seafood per week.
Doctor, Doctor, what do you say for those who say that red meat is bad for the health? I myself, I'm someone who eats a lot of red meat on a daily basis. And whenever I look, people tend to say that meat is going to kill you. And I'm like, well, I like it. So the question is, why people usually tend to think that red meat is bad for us?
Red meat is healthy, but not every day. And the amount is also important. So because meat is acidic, and when you eat it, it causes some stress, oxidative stress. And we know that there are some scientific proofs that it can increase the risk of colon cancer. That's why it's better to avoid it. And when it comes to cardiovascular disease, yes, we should be careful while eating the red meat. So as I said, the portion is important. But I also, so there's also another one topic. Previously they were saying like Mediterranean diet is the healthiest diet because it provides a longer life. Then we had other studies, and these studies showed that actually, if you eat like your grandparents, then you can live longer. So it depends on your genetics. That's why, for example, a Japanese person goes to the USA, the diet will be completely different, and this person will lose his or her health. That's why we should eat like our ancestors, grandparents, but also we should move like them because they were farmers or they were having animals. They were with their animals, so they were active. They were walking during the day, and they didn't have such a stressful environment. Previously, people were working for about 5 hours per day or maybe 3 hours per day to have all their needs. But today, we tend to work more than 8 hours every day. So that's why we should move more and then we should eat what our grandparents eat.
That is very interesting, by the way, what you just mentioned, that we should eat like our ancestors. I actually had one of my friends who is from Syria, and he's now living in Germany. He once told me that during COVID, him and his work colleagues had to live in the same house, and they had to eat, let's say, traditional German cuisine or dishes, let's say, food. For his friends, they didn't gain weight. However, he gained a lot of weight because like he was following a diet that does not match him. So my question is, why is that? Does our microbiota plays a role in how does it, let's say, process the food? Or like, does the microbiota get habituated on what we eat?
So it's not just microbiota, it's also about genetics. So we have some genes. Every individual is different. Some individuals tend to burn fat very easily, but some not. And it's the same for carbs. So it depends on your nationality and your own genes. In one, for example, I know my genes because I did this diet genetic test, and I know what I should eat. I know what I shouldn't eat. So I'm Turkish. I'm from the western side of Turkish, and if I eat oily, fatty things, I tend to gain weight. But if I eat carbs, I can absorb carbs very less. That's why even if I'm eating carbs, I'm not gaining weight at all, not so much. But if I eat oily fatty things, I can absorb them so easily. And that's why I will gain weight. I will, yes, yes. So it's about our genes. And my family is the same like me. We are all the same. If I eat nuts or fatty fish, or if I love olive oil. If I eat too much olive oil, then I'm definitely gaining weight. But if I eat ice cream or fruits, I'm okay. Yes, that's true. Of course, we have many hormonal disorders that can cause high testosterone levels, and it disturbs a woman definitely because a woman should have lower levels, according to a man, lower levels of testosterone. And if that lady has high testosterone levels, then she will have increased hair on her body, like above the lip, upper lips, and here, and then in the middle, in the center of the body, around the areola, the mama, breast tissue, and of course it won't be nice. The voice can be even like a man, so behavior will change, acne problem will come. That's why we don't want high testosterone levels in a woman. Also, there is one topic, actually there's a gap about this because we don't know what is the lowest level for a woman for testosterone levels. But we need testosterone too because it also gives us energy. It also gives us some libido, and it's important to feel energetic during the day. But we don't have any cutoff for this. Once I had a patient, I still remember her because her testosterone levels were so high. It was about 700 something. She was so happy. She was a postmenopausal woman. She was already in menopause, and she didn't have any fatty tissue. She was all muscle. And when it comes to, and she was telling me that so around her house, she was living in a mountain, and then it was so harsh to walk with that mountain, but she was walking like very easily, and she didn't have any fatigue, full of energy. She had that libido, and she was very happy. Then I offered her treatment, and she refused. She never came back again. Yeah, so that's
I think she's the exception for the rule, as they say. Like she's the black swan, as they say.
sorry.
I think she's like the exception to the rule because, like, from like she's one of very few. Let's say.
Definitely, actually, one of a kind. I never saw any patient like her, and nobody could understand what was wrong with her.
Is there like any disorders which are gender specific that, for example, only men get or only women get, depending upon the level of hormones in their bodies? In other words, uh, because of estrogen levels in women, do they tend to have more disorders which are related to estrogen? And the same thing for men. Do they have like some disorders which are related only to men?
Yes, definitely we have. So we can start with men testosterone deficiency. If a man has low testosterone levels, definitely he will gain weight, especially fatty tissue. Even if he goes to the gym, he cannot gain muscle mass. And the personal trainer, if he has a personal trainer, they usually send these people to us because they are like, okay, you are eating well, you are doing a good job for the in the gym. Now you should gain that much muscle mass, but there is no difference. And also, it causes erectile dysfunctions. A man should have morning erections every morning. If they don't have, then it's a alarm for testosterone deficiency. And when it comes to women, we need estrogen, just like men. Actually, I think menopause. Everyone says like menopause is normal. Maybe it's the natural end, but it's not natural because it causes too many harms for a woman's health. For example, cholesterol levels. Definitely, good cholesterol goes down, and then bad cholesterol goes up. And cardiovascular disease risk increases. Bone health definitely impaired. We have osteoporosis after menopause. So menopause causes many diseases in women, and also it causes lack of energy. It causes fatigue. Definitely, it's a fatigue symptom, fatigue reason. Sorry. And also definitely it disturbs sleep because if you have these flushing sweatings, how can you sleep? So it will disturb your sleep, then all your hormonal balance will be affected. And mood swings, of course, during menopause there is more irritability, aggression. So estrogen deficiency is a topic actually. And unfortunately, we can have estrogen deficiency even without menopause. Yeah, this is also another topic. So, if a female gender person born, for example, I was born, for example, 200,000 ovaries in my ovarium. And during time, I'm consuming them. So in every menstrual cycle, we don't spend just one egg. We spend maybe 1,000 eggs. And when a woman reaches 30 years old, she has only 10% left according to her beginning ovarian reserve. And when she is 40 years old, then she will have only 3% of her reserve. And our reserve releases estrogen. The less you have a reserve, the less estrogen. So even if you don't have any menopause, menopause symptoms can start 7 to 10 years before menopause. Yeah. So the average menopause age is 45. Usually ladies are getting menopause between 45 and 50 years old. It means that starting from 35 years old, you can have menopause symptoms. So if you are 35, 36, or 39 years old lady, if you start to gain weight, if your body shape is not like hourglass anymore, and if you tend to feel more tired earlier than before, if you have fatigue, less energy, and if you are going to a doctor, and if everything is fine, there's no thyroid problem, no anemia, B12 is normal, iron is normal, everything is normal, but maybe it's a symptom of menopause.
Very interesting. Doctor, like I once read that men also, as they grow older, they would tend to have less and less testosterone levels. However, they can, let's say, solve the issue via, let's say, taking testosterone or going to a doctor where they can prescribe them a testosterone replacement therapy, where they can feel better and, let's say, have more energy. Can I say women can have the same option as they go close and close to menopause if they supplement?
Yes, thank you asking. Thank you for asking this question. Sorry, the voice was interrupted.
Yeah, I was saying, like, in men, they can take, let's say, testosterone as they grow older, and they would still feel good as they are growing older. Can I say that women also can take estrogen when they are close to menopause and their life would continue the same? Is it the same equation?
Thank you so much for asking this question. Because 80% of postmenopausal women need hormone replacement treatments because we have that option. We can give estrogen and progesterone to the ladies. 80% needs this. Can you imagine? But only 10% receive HRT, hormone replacement treatment, because they are afraid of having a cancer. But we can reduce cancer risk actually because if we give only estrogen, then we can see some uterus cancer. Okay, but if we put some progesterone, then we will protect it. And if there is no uterus, then we can give simply only estrogen. So definitely, if a lady has some menopause symptoms, it's better to go and visit a gynecologist or an endocrinologist or an internal medicine specialist for hormone replacement treatments.
Very interesting. Thank you for that, doctor. I actually didn't know that there's an hormonal replacement therapy for women. So this is the first time that I hear about it. So thank you. Doctor, one more thing, please. Like now, men are having less and less testosterone statistically. Now, I also read that women are tending to have their menstrual cycles earlier on in their age compared to before in time. Why is that? Like, why is the age gap of having the, say, the first menstrual cycle is getting in younger and younger women nowadays?
Yes, it's about the chemicals that we are eating. By the way, climate is also another reason. So, if you are living in a warmer climate, of course, the first menstruation cycle will be earlier. It's normal. If you go to the northern sides of the world, the first menstruation cycle will be delayed to 16 years old. But if you come to the hot countries, then it will be 10 years old, maybe 9 years old. But of course, we don't want it because it can stop bone um, growth. So maybe the height will be less than normal. And for to avoid this, it's very important to avoid processed food. It's very important to eat organic food. But on the other hand, it's hard to recommend everyone organic food because they are more expensive. It's not a luxury. Yes, so it's one of the reasons.
So honestly speaking, actually now when I think of it, like food plays a very big role in our life when it comes to the overall health, in addition to sleep, hydration, stress levels. So I think if people can like have a balance between all these factors, their lives will tend to be better, their minds will be better, their mood will be regulated, physical body will be better. It sounds easy. However, when we want to apply it in real life, people find it hard to do because of the too many temptations in the environment.
Yeah, I 100% agree with you. Definitely, you're right. Because to reach good food, you should go and do your shopping by yourself. Then you will choose organic food. You will pay a little more expensive, and then you have to cook. People usually don't have that time and energy also to cook their own meals. And then you should carry these foods with you to the workplace or to the other side. But usually we tend to go to the restaurants and eat and enjoy with our friends or colleagues together. So our social environment is not so good for these options. Not, I cannot say good, but our social environment kind of avoiding a good lifestyle.
Doctor, I have one more question. People usually say that sugars or let's say high carbohydrates diet is bad for the health. Is that true with everyone? Or as you mentioned, for example, our genes play a role. So what's your intake on a good, let's say, diet in a sense?
So thank you for this question. Because carbs will definitely affect your blood sugar levels. Why is it important? Because even if you don't have any diabetes or prediabetes, let's say you are completely a healthy individual, 80% of us have high blood sugar levels after meals because of these foods. So we have to avoid these glucose spikes. Because we are not diabetic, we don't have any prediabetes, so our insulin level secretion is still normal. There's still a normal response to the high glucose levels, but we should avoid high insulin levels. Why is it important? Because today we know that if we want to have a longer and a healthy life, then you have to have low insulin levels. That's why. So you can of course eat a dessert, no problem. But it's important when you are eating. There are some tips to avoid these glucose spikes. Do you want me to talk about them?
Yeah, let's talk about them. Yeah, please.
Okay, so if you eat the veggies first, then the carb absorption will be less because veggies have fiber and fiber avoids carb absorption. So definitely the blood glucose spike will reduce. Definitely. So eat veggies first. And then you should eat protein and fatty things in the middle. And carbs last. So if you want to eat a dessert, you have to eat it after the meal, not in the beginning. And you have to start your meal with a salad or a veggie like baby asparagus or spinach. You have to start like this. Then you can eat fish, red meat, chicken, whatever you want to eat. And then in the last, you can eat bread actually. So you can eat hummus first and then bread. It's like this. And if you want to eat hummus, And if you want to avoid the glucose spikes, don't eat it with bread. Eat it with, you can prepare sticks from carrots or cucumber, and you can eat your hummus with them.
Very interesting, actually. So, like the sequence of the meal that we eat also plays a role. Like, because some people think that, okay, I'm just eating and my insulin would be spiked the same. However, now you mentioned that fiber and, for example, protein and fats affect the insulin spike if we need to eat a dessert, basically.
Yeah, actually, it's just to avoid the carb absorption. By the way, protein and fat, yes, they also cause some higher glucose levels, but after 2 hours, not right after the meal. Right after the meal, if you have glucose spikes, it's because of the foods that you are eating. And and if you eat starch like potato, or if you eat like normal sugar, then you will have increased blood glucose levels more and more. We call it glycemic index. Have you ever heard of it? Perfect. So if you eat low glycemic index foods more, then you will have less glucose spikes. Please avoid high glycemic index foods.
Thank you. I also heard once about the glycemic load, basically where they talk about, for example, carrots um, has a low glycemic index. However, on when you want to think about it on the terms of, let's say, eating 100 grams, then it would be like a high glycemic load, I think, or vice versa. I'm not very sure, actually. So there's the glycemic load also plays a role. It's not only about the glycemic index, because some foods on the glycemic index, they would be low, and on the glycemic load, they would be high. So, yeah.
Your glycemic load is also important. If you are eating too much carbs, then you will have too much glucose spikes. Yes, this is the correlation between them. And when it comes to carrots, yes, carrot has a low glycemic index if it's raw. The moment you cook it, the carbs will be divided into smaller pieces, and then glycemic index increases. So how you cook is also important. For example, pasta. I love pasta, but if I want to avoid glucose spikes, I have to eat it al dente, because if I cook it more and more, then it will be divided into even smaller pieces, and then I will absorb it even easier, and it will cause glucose spikes. And another tip to avoid glucose spikes is walking. Just go for a walk for 10 minutes after a meal. It can reduce glucose spikes like up to 30%. It's really useful.
Actually, that tip I usually give to my clients. Like, as the personal trainer, I usually tell them, after you eat, go for a walk. Then just come back because it's going to reduce your insulin spike. Thank you for that, doctor. I'm going to tell them that this tip is approved by Dr. Zeynep now.
Definitely, you can say that.
Doctor, is there anything that I didn't cover that you would like to talk more about, and maybe I forget to talk about? Is there anything that you want to share before we finish the episode?
Actually, we talked very good topics today, and I think that's all.
All right. Dr. Zeynep, thank you so much. Thank you so much for being here on the show. I very do much appreciate your time. And I wish to have the chance to talk to you later on in the future, maybe. And until then, I wish you all the best.
Thank you. Thank you so much for having this opportunity to meet. It was lovely to meet with you. Thank you.
My pleasure, doctor. Have a wonderful rest of the day.
You too. Thank you. Bye.
Thank you. Bye-bye.